Hello everyone, my name is Arti and you're watching HW News. After almost 2 years of pandemic, the normalcy is returning across the world. In India, several states including Maharashtra and West Bengal have lifted the COVID-19 curbs fully from April 1st onwards. Now this means that the citizens of these two states at least no longer have to follow social distancing. They no longer have to keep sanitizing their hands every time they touch an object. There is no restriction on how many people can attend any public gathering or sit in a movie theater or travel in a bus or train or say metro, etc. Even wearing mask is not compulsory anymore. It is completely voluntary. So if anyone wants, they can definitely follow all these hygiene factors and all these restrictions, but there is no compulsion from the government. But does this mean that the COVID-19 pandemic threat is over, or the pandemic is now a thing of past? As much as we would want it to be the case, it may not be so. After Alpha, Beta, Delta, Omicron, Delmicron, now there is another variant of COVID-19 that has come up, that is XE variant. 2 days ago, BMC claimed that a patient infected with XE variant of COVID-19 was found in Mumbai. The patient is a costume designer from South Africa. However, the central government has said that there was not enough evidence to say that it was indeed an XE patient. But even so, the new variant has rung an alarm bell for the country that is just recovering from the bout of second wave of the pandemic and the third wave of the pandemic. The second wave claimed multiple lives and the third wave left multiple people infected with COVID-19 pandemic. Now, scientists have said that the XE variant is also 10% more transmissible than the Omicron. So what exactly is this XE variant of COVID-19? How serious is it, and how serious we should take the new variant of coronavirus? Let us discuss this all in detail with Dr. Ishwar Gilada. He's an infectious disease expert and has appeared on HW News Network. He's a go-to expert on infectious diseases when it comes to such viruses and in fact COVID-19. Doctor, welcome to HW News. My first question to you is, what exactly is this XE variant of coronavirus and how seriously should we take it?
This is not a variant, it is a sub-variant of Omicron. And Omicron had two sublineages, which was BA.1 and BA.2. When it started in South Africa, Botswana and Europe, it was BA.1. And by the time it came to India, it was already BA.2. What has happened in Europe was they already had a Delta wave which was tailing. So the wave was going down. At that time, Omicron came in. So in some countries, Delta and BA.1 of Omicron, they got hybridized. In France, it was XD, and in UK, it was XF. And thereafter, when the Delta was completely replaced by Omicron, and Omicron had BA.1, and it was tailing, and it was going into BA.2. So BA.1 and 2 got hybridized, and that became a hybrid subvariant of Omicron. And that is BA.1 plus BA.2, and that is called XE. Now, whether it is a serious, whether it is a real matter of concern, I don't think so, at least for India, for two reasons. One is, India, we are seeing already numbers are so low. In a country of 140 crore people, we have less than 1,000 cases per day. The number of cases which we used to see in one particular ward or one particular area in Mumbai, and if you are seeing in the entire country 1,000 cases, there is nothing. Secondly, the trajectory of cases after somebody is infected with Omicron, how many of them are landing up in the hospital, what is the oxygen requirement, how many are getting into the ICU bed or ventilator requirement, and how many of them are dying. And that is extremely low everywhere. So that's what actually we want, that any kind of infection which comes and goes within 2 or 3 days, it doesn't affect you so much, it doesn't make you require oxygen, it doesn't make you sick enough to go to hospital, and it comes and goes, and it makes you immune for next foreseeable months, maybe a year also. So in that situation, India has done well. If you go by comparison of India with East or the West, I think though 2 times, 2 variants, 2 subvariants, 2 vaccine, nothing can be compared. So if just by getting worried or worked up after seeing cases escalating in East, what has happened in the East was they had a very strict lockdown during the first and second phase. Because of that lockdown, a lot of population could not, or they did not get infected. When the population is not infected earlier, that means more population is available as vulnerable population to get infected. In Europe, as I told you, it was BA.1 and then BA.2 came, therefore the lingering on is going on. In India, it came only BA.2, we hardly had one or a few cases of BA.1. So in that situation, India is already overcome that situation. Only if your variant comes, more severe variant comes, then we should be concerned. And real life situation tells in India that we had elections in 5 states in last 2 months. We had Holi, we had socialization, people are traveling in train and they are in public gardens and everywhere. And despite this overcrowding, cases are not increasing. That means despite challenging situation, cases are not increasing. And therefore we can safely say that we have overcome COVID, we have overcome Omicron, and possibly nothing would happen to us. If at all, it will be endemicity. In some pockets, some infection will happen and it will go away. So we should not be bothered about endemicity, but epidemic or pandemic is over as far as current situations are concerned. However, there could be caveats like people who are not given vaccination in Africa, there because of unvaccinated population, there could be churning around newer variants. Couple of the variants or maybe one variant of that will become variant of concern and that can travel to India. So all these are ifs and buts available. So our now duty remains that we should see that all parts of the world, irrespective of their financial status, should be vaccinated.
This particular variant, a sub-variant of Omicron, is said to be 10 times more infectious than Omicron itself. Now, we saw that the Delta variant was more infectious than the previous variant, then Omicron was more infectious than the Delta variant. Now, this particular variant is also more infectious than the Omicron itself. So, if we just consider the infectious, level of this variant, then do you think that it should still be a matter of concern if we found any cases of XE in India?
Arti, I'll first correct you. It is 10% more infectious, not 10 times more infectious.
10% more infectious.
10%.
Okay.
And 10% is not a big thing because if we have seen the original wild type of virus, which is called Wuhan virus, after that Alpha came. Alpha was 1.5 times more, that is 50% more infectious than Alpha. Original virus. Then Delta came, it was 4 times more than the original virus. So similarly, Alpha, Beta, Gamma, Delta and Omicron, they were a couple of times more infectious than the previous viruses. And if Omicron and Omicron newer subvariant is just 10% more infectious, it doesn't make a matter of concern at all. Secondly, we should not go by number of infections, we should go by virulence. How virulent is the virus? Whether it makes person sick or require oxygen and kill them. If it doesn't kill, if it doesn't hospitalize them, it doesn't create any oxygen requirement, I think numbers do not matter. And we have seen that in Kerala, despite very high numbers, they manage very well. So trajectory is more important than the number of infections.
Okay. However, the WHO has said that it is too early to reduce the quality of surveillance, even though across the globe, I think the restrictions are now coming down. Even in India, in Maharashtra and West Bengal, the COVID restrictions are almost equal to none. But then too, the WHO has said that it is too early to, reduce the surveillance.
See, Arti, understand one thing. WHO is an intergovernmental organization. And the goal of WHO is not only India or a few part of the world. The goal of WHO is each and every country in the world. So therefore, they will keep on giving warnings. And it is up to us what warnings we should take seriously, what warning we should dilute. And there will be always situation where we would like to challenge. And we have challenged currently. We opened up in Maharashtra, there is no masking. After no masking, after almost 10 days of work, we are not seeing any escalation of cases. So, if you look at 90% of the current 90% of our population is already having a natural infection. 78% of the population is already vaccinated, double vaccinated. In that situation, if you calculate that, 85% of us have a hybrid immunity, and at least 95 to 96% have some immunity, whether it's a natural infection immunity or vaccine immunity. In that situation, we have only 4-5% population which is vulnerable. Initially, we used to think that herd immunity will come at 60 or 70% of population is infected, other 30% may not require anything. But that 60% changed to 70, 70% changed to 80%, and we realized that the herd immunity concept for COVID was totally different. But currently we can say that 90 or 95% infection is a herd immunity, because the remaining 5% people, and 5% percentage looks small, but in a 140 crore population, 5% becomes almost 6 crore people. So in 6 crore people are hardly 1,000 people are getting infected. I think we have reached the herd immunity, and we have reached a point where no more escalation will be available with current variants available. So I think we should not be bothered about what WHO says. Yes, WHO's warning should be good for maybe Africa, where vaccination is poor, or maybe in the east or west where the cases are going up. But for us, it doesn't matter. And lastly, even WHO should become a little wiser now. Currently, people are having a COVID fatigue, lockdown fatigue, they are economic fatigue. So in all ways, they are fatigued. So if keep on giving restrictions, people will not listen to you. So there is always a time when you should understand how much people are able to absorb. If people are not able to absorb your restriction, give minimal restriction. That mask up in crowded places. So if you say mask up, they will not mask up. Use mask up in crowded places. People will listen. Mask up in hospitals. Mask up in places where there is a more quantum of infection. I think that people will listen. Otherwise, people will not listen.
No, I think I agree with you here, because a lot of people, I have also seen, even after Maharashtra has stated that there will be no fines if you don't wear mask, lots of people are still hesitant to take off their mask in public places. So
it's voluntary. It's voluntary.
Yes, it's voluntary.
It's not mandatory. At least you are not fined for not using mask. But you want to.
Correct.
There were people in Thailand and Vietnam and Korea before even COVID pandemic. 60-70% people used to wear mask on the road when driving. That would protect you from pollution. That will protect you from other infections. So that is up to you.
So I think one thing that you spoke about is not India, but India seems to be bucking the trend. But in other countries, say for example in China, in Shanghai especially, the COVID wave has returned and there are very strict restrictions in place. So what exactly has happened with India that we are able to buck that trend?
No. You see, if you look at some strategies in India, and compare that, like Telangana opened up 6 months before August they opened up, and those places which did not open up, did you see any difference in pattern in infection? That those who opened up, they had more infection, and those who had not opened up, they had less infection? Nothing like that. You see during the UP wave, when there was a second wave, a lot of people were dying there, and people were not saying no, so many cases are not there. Maharashtra was honestly reporting, Chhattisgarh was honestly reporting. But wherever the cases are more or less, do you see any difference now? No difference. So basically, we do not know which strategy is good or bad. So I don't think any two times or any two strategies are comparable for COVID. As far as Shanghai is concerned, actually no one can advise China, and China may not listen to any advice. But they should allow people to get infected with the Omicron, so that there will be no future wave. Because Omicron is not like Delta. It's not going to kill people. You just try to protect those which are vulnerable people, which are with a lot of comorbidities, which are elderly people, and you vaccinate them properly, so that you don't create any kind of restriction. And secondly, what we have seen during Omicron wave in India, even if you are masked, you are still infected. So it was going through mask also. We don't know. So
yes.
And in a family situation, if one was infected, entire family got infected within weeks' time. It was that infectious. In that situation, any kind of very heavy restriction are dead wrong. But it's their own policy. We cannot comment on that.
Okay. Again, one last question. There are also concerns of whether there would be a fourth wave in India. What do you think? Will there be a fourth wave?
You see, fourth wave will be like a ripple. And after any earthquake, there are always small or big tremors. So I think we should not be bothered about tremors. Secondly, who is saying fourth wave? Those which have no scant acquaintance with any public health. The people from IIT Kanpur, people earlier they said there will be not going to be a second wave. What happened? Second wave, we were devastated, and Government of India listened to them. So I think we should not give any credence to them. As much as if I start speaking about any machine equipment, IIT studies, you don't give me credence, because that is not my forte. So if people giving headlines to those people who do not understand public health, just because they make some calculation and projection and say that, and nonsensical approach where they're saying that fourth wave will be there on 21st of June. What kind of projection you are giving? Can you say on a particular day there will be? So I think this kind of thing do not need any kind of attention or any credence.
All right. What would be your suggestion to the government, if at all the new variants are to come?
My 2 or 3 basic suggestions. We should have a pandemic preparedness. It's not merely for COVID, for any pandemic. So we should tone up our primary, secondary, tertiary healthcare in such a way that whichever wave comes, we'll be taking care of them. And classical example is Odisha. We have seen that after the cyclone, Odisha geared up so well. Any cyclone come, hardly 1 or 2 people die, rather than thousands of people who were dying earlier. So that preparedness. Secondly, make committees less and less. You create so many committees and so many confusion. You get a vaccine cleared by DCGI, but INSACOG says no vaccination to be given. And then another committee says to be given like this. It takes 4, 5, 6 months time. And then there are a lot of advisories from this committee, that committee, ministry, Niti Aayog. I think that is confusing. So create, maybe if you are not content with 1 or 2 layer, but not many committees. And thirdly, open up challenge. Thing will come our way. We'll see how it happen. If at all there is something happen, it is not going to be overnight. You will get crores of cases. So it will go slowly, and then keep on plugging those holes if you at all you feel. But otherwise, there is no role for any kind of fear complex now. We should not be panicked at all. We should not be concerned about what is happening in the east or west. And India is the best.
Thank you so much, sir. Thank you so much for this information.
Okay.